Can we talk a little bit about antibiotics and acne? Pet peeve of mine. It's something that I see really commonly in the clinic is girls that have been to their GP or to a dermatologist with acne and put on antibiotics, predominantly doxycycline. Often what I find is that it's a bit of trial and error. So you'll put on like a 3-month program of antibiotics and hoping for the best. You're kind of told after the first few weeks, even if it hasn't worked, let's keep going on the antibiotics for 3 months and then decide whether or not it's working, which is a long, long time on antibiotics. And then at the end of the 3 months, I have seen countless girls that have been told, and guys, that have been then told, let's keep trying. Let's keep going with the antibiotics, even though they're not really working for the acne. Nothing's changing. Or things have changed, skin's clearing up, antibiotics have done their job, but we come off of the antibiotics and skin goes back to how it was before. Sometimes skin goes back worse than how it was before. Antibiotics are a life-saving medication. There's no denying that at all. But they need to be used with caution because, like all medications, they have side effects and they can have some long-term effects. And long-term use of antibiotics can have some very real long-term side effects. So let's look at why we might be using antibiotics for acne. Maybe there's a bacterial overgrowth. And perhaps let's look at other ways that we can manage the bacterial overgrowth and we can support the body into clearing that itself, because there's a reason why you are unable to control natural bacteria that you're coming into contact with, but I am, or the person next to you is, or let's say somebody sleeping in the same bed as you and they're in contact with all the same bacteria and their body isn't reacting in the same way. So let's look at why their body is not reacting in the same way, why your body is reacting in a particular way, and let's treat that. If you have done a long-term course of antibiotics and you found that it worked while you were on the antibiotics and then you stopped the antibiotics and things flared up, reason for that, because we haven't treated the underlying cause. We've just inoculated the bacteria while it's there, but all of the environmental factors, all of your medical factors and your health concerns and all those things, they're still there and still present. So we stop the antibiotics and things go back to either how they were before or worse in many cases. So if that's you, let's get on top of it and treat it effectively. And we can use things like probiotics, so supporting gut health and making sure that the gut microbiome is actually able to deal with these bacteria as it comes in contact with them without causing this huge flare-up of inflammation that's then presenting as acne. We can also look at using things to support the immune system. So again, it's our immune system that's going to be fighting these bacteria, and we want to make sure that it's well supported long term. So for not only things like supporting acne and skin health, but a whole host of other reasons that we want to make sure that our gut and our immune system is functioning really well. So if you are struggling with acne and you've been suggested to go on antibiotics and you don't like the idea, or you have been on antibiotics and are struggling to come off of them, or you've been on them and had other side effects from the antibiotics, let's chat, because we can help you work through this. We can help you clear up your skin, we can help support your immune system, we can support your gut, and we can get you past this acne without needing round after round of antibiotics and doing some really potentially nasty long-term damage to your body.